but those toxins impact time to natural conception. So there's about a 30% increase in time to conception when these toxins are present. They impact the health of the pregnancy. So some of these toxins increase the risk of preterm birth, both in mom, and what's even crazier, but not crazy to you because we know about epigenetics, is even when dad is exposed before conception, there's increased risk to these toxins, increased risk of preterm birth. And then that generational epigenetics piece, some of these toxins are linked to cognitive issues in children at 7 years old, to obesity, eczema, behavioral issues. So some for mom, some for dad. When with mom, there's also typically some perinatal exposure. But the crazy part is with dad, what dad's being exposed to during pregnancy is not impacting that baby's epigenetics anymore. So this is a preconception thing. That sperm was exposed to a toxin and is having an effect when that child is 7, 10, 11 years old.
I have such goosebumps listening to you. And so we actually know now that the sperm epigenetically program the health and the function of the placenta, which is one of the primary pathways through this is occurring, and can account for a certain up to 19% greater risk of miscarriage, of stillbirth, and can also contribute to preterm birth because the placenta is very much involved in the maintenance of the pregnancy and the health of the pregnancy. So I'm so glad you brought this up because it just reminds us, and I don't think we need reminding anymore because I think we get it now, but it reminds us how trimestering and ensuring that we have healthy fertility, healthy pregnancies, and our super babies isn't just the work of mamas during pregnancy. It starts in the trimester, at least of the 120 days leading up to conception. And it's not just her work, it's the person providing sperm's work as well. And, if that's the dad or a sperm donor. So thank you so much for reiterating that. And we also know that phthalates are linked to, and some of these other toxins, to programming infertility or fertility challenges in the next generation. So exposures perinatally and leading up to conception affect the fertility of male children and female children. So this is not a small thing. We really, really want to feel empowered to understand our status the way that we can through this testing, and also to be able to make changes, which we guide you through in the most incredible amount of detail in the trimester protocol, that and 1,000 other things that are relevant to programming your fertility and the health of your super babies. So thank you so much for saying this. Is there something else that you want to add about what we were just talking about? Yeah,
I do. I want to add while we're on this toxins topic. So so yes, generations down the line, it impacts the fertility of our babies and if that lineage will even continue. And then if we back it up even further, I think today a lot of women are waiting longer to conceive. It is what it is. And these toxins are also, like, on the other end of the spectrum, associated with premature ovarian insufficiency, premature ovarian failure, early menopause, decreased egg quality, decreased egg count. And so addressing these 10 years before you even think you want to conceive, or for every woman, whether or not if you want to be a mom yet, if you even want that as an option, this needs to be a conversation among women as a group of these toxins are maybe leading cause, maybe just a cause, but definitely a contributing factor to this ovarian decline and rapid ovarian aging that is then resulting in fertility struggles, resulting in infertility. And there's so much prevention that can happen, but these things are so ubiquitous that we really need to have like that. And I think we're seeing it like in social media. I think there's a lot more talk about toxins. I've even seen reproductive endocrinologists talking about toxins, and I'm like, woo, yay.
Yes. Yeah.
So there's that, prevention aspect for maintaining our own fertility decades before we want to conceive, all the way through how this can impact our lineage.
That's so beautiful, so important. Dr. Zagoni, this has been incredible. And I have 100 more questions that I want to ask you. So I know this conversation is to be continued, and you and I are going to be doing a lot of work together, which we're very excited about.